Brandon Robb, hi.
Hi, nice to see you.
No wheelchair.
No longer
crutches.
needed. No longer needed.
Walk up and down, would you? And a good posture.
Yes. Bit of a
I'm
change.
so pleased. Come and sit down. Thank you for taking the time to tell other patients what happened to you. It's a very special story. But before you tell us that, I ought to introduce myself. I'm Martin Knight. I started developing the concept and technique of endoscopic foraminoplasty in January 1990. And to date we've treated over 5,000 patients with complex back problems of all ages, with and without failed back surgery since then. So tell us a bit about yourself before problems started.
I was a registered manager with the Healthcare Inspectorate for Wales for a private dental hospital for 12 years. We've now been married for 14 years this October.
What sort of lifestyle did you have?
Lots of holidays, just generally enjoying life, socialising, spending a lot of time with close friends.
And your husband was working?
Yes, Rob was running his own garage with 3 employees.
Excellent. As I recall, your problems started with low back pain in October 2009. You had an x-ray of your spine and then subsequently a scan in March 2010, and they found an L5-S1 disc protrusion, but they told you it would settle.
Yeah.
2 months later, you lost anal control and sensation.
Yep.
But rather than have an immediate operation, you were put on the waiting list.
That's correct.
On the NHS. But after 8 months, you felt that something had to be done, and you underwent a microdiscectomy at L5-S1 in February 2011.
Yes. My microdiscectomy was undertaken on a private basis, which we had to self-fund due to life passing us by, and we just wanted to get life back on track. I had some relief of pain for a short period of about 4 weeks with an improved posture, but the anal sensation hadn't improved at all. By the time I went for my 6-week post-op, the disc had actually prolapsed again.
By August 2011, you had lost bladder control in addition, so you were then doubly incontinent. But in October 2011, you had an audible popping sensation in your back, and this affected another detrimental step change in your life.
Yes. Prior to the pop, I was just leaking urine, but post-pop, I was actually flooding urine, which ultimately left me wheelchair bound for reasons of dignity and also increased left leg weakness. So at this point, every time I was weight bearing, I felt as if I had a pressure through my head, which was compressing my spine and just increased pain.
In January 2012, you underwent an L5-S1 nerve root block that actually exacerbated your pain, and you ended up being admitted to hospital for 6 months.
Yeah. So I was told that my symptoms were all psychological, and I was transferred to a stroke rehabilitation unit.
Applied for cross-border funding for a second opinion for Brown to see a different consultant. Brown was recommended to have a 2-screw sacro-iliac joint fusion.
So Bran, how were you after that major operation?
No change in symptoms. Still doubly incontinent. If anything, it was an increased pain. So in June 2013, I was told that there was nothing else that could be done, and I had to learn to live with it.
I saw Bran and Rob in July 2013, just short of 2.5 years from the first operation. At that time she was bedbound, doubly incontinent and catheterized, unable to walk on the left leg or sit on the left buttock.
So my first memory of Mr. Knight was him counting 1 to 6 and back again, and then asking if we knew that I had an extra vertebra, to which we replied no, and then he went on to ask who put those blasted screws in your SI joint.
After due consideration, Bran decided to undergo minimally invasive spine surgery. At the lowest level, we found widespread scarring, an overgrown facet joint pressing onto the back of the nerve, and vertebral margin shoulder bone spurs pressing into the front of the nerve in a pincer action. The superior foraminal ligament was adherent to the nerve. The nerve was flattened, distorted, medially displaced, and non-pulsatile. After removing the scarring and the bone spikes and enlarging the doorway, the pulsatility to the nerve was restored all the way from the axilla of the nerve down to the inferior pedicle, and I managed to explore the dura. 2 discs further up, probing in the foramen, reproduced her back pain and right flank pain. She had a central collection and a fluid-filled bulge, and this level was treated with a laser disc decompression.
So during the procedure, I can remember having some unusual nerve pain as Mr. Knight was doing his investigations, but it wasn't a pain that was any more severe than I'd already experienced up until that point. But then I don't really remember much of the latter part of the surgery.
And how long was the operation?
It was approximately 3.5 hours. So an hour post-op, Mr. Knight came in and encouraged me to get out of bed, where I walked pain-free for the first time in a long time with the assistance of the physios. The following morning, I had an abdomen pain, which turned out to be that I needed to have a bowel movement, and it was a sensation that I didn't recognise as I hadn't had it for so long.
As I warned you, rehabilitation would take a long time, and in fact it's taken about 3 years. You started off as a 39-year-old in a wheelchair. Take us from there.
It's been a long, hard road. Progressed from the wheelchair onto a Zimmer frame, then onto crutches, onto a single crutch. But I then got involved with the pain management programme in our local area run by Dr. Jeffs, who, like Mr. Knight, is the only person that fully believed in me. And here I am.
Bran, in the early stages after this operation, what was one of the most important benefits you noticed?
That most remarkable benefit was that I regained my dignity and my husband no longer had to change my nappy at night.
Whilst Bran has gone down a very long road, we mustn't lose sight of the enormous effect that this has on the carer.
As Bran's recovery got better, I didn't realise how much the stress had taken out on me. And subsequently, twice I've been admitted to hospital with severely high blood pressure and had 2 stress attacks.
So Bran and Rob, I understand you've got some rather exciting news.
Yes, we have. We've been put forward for adoption. Now Bran has passed all medicals, and hopefully very soon we'll become a family, which very much thank you to Mr. Knight and the Spinal Foundation.